Welcome everyone to another Life and Breath Foundation educational webinar. My name is Saul Kachauskas. We're very happy you joined us here tonight. Tonight's topic, CBD, what it is, what it isn't, and how to use it safely. Before I introduce tonight's speaker, a few words about Life and Breath Foundation. Our primary goals are to offer the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize the quality of life, to provide a nurturing environment for those affected by sarcoidosis so they can share their experiences, to build more awareness within the medical community to help combat this chronic disease. What we do, Life and Breath is a volunteer-led organization. The money we receive through donations and sponsorships goes directly to supporting patients with sarcoidosis. The services we have are monthly speaker series that you're on tonight. You have the Life and Breath Scholar, physician and residency programs for their education, patient support from sarcoid experts, patient support through sponsorships and education. We also have my Life and Breath Planner. You can support Life and Breath through Patreon or share your story on our social media. Some additional news, talk about the planner. It offers a sarcoidosis roadmap from sarcoidosis diagnosis through the journey, providing a health tracker, organizing medical records, and it has a documents keeper. Also very important to note, this planner is not medical advice. Please consult your physician before making changes to your care plan. Better yet, share this with your physician during your visits. The planner is available for free in digital or paper format at lifeandbreath.org/sarcoidosis-planner. Also, just to note the questions for tonight's session, we had a few submitted already prior. But if you do have additional questions, please submit them on the Q&A, and we'll do our best to answer them for you. Okay, our speaker tonight is Dr. Richard Harris. Dr. Harris is a board member here at Life and Breath and a sarcoid expert. He's also a regular speaker with our series here. Dr. Harris is board certified pharmacist and holistic lifestyle internal medicine physician in Houston, Texas. With a passion to educate, Dr. Harris uses a holistic approach to wellness. To learn more about Dr. Harris and subscribe to his podcast, please jot down theghwellness.com. It's theghwellness.com. Okay, Dr. Harris, welcome and thank you for being here tonight. It's all yours.
We're going to talk about one of my favorite things, and that's CBD. My background, I love utilizing supplements and lifestyle medicine as a first line for people, and using prescription medication when needed. One of the things that we've seen pop up a lot is CBD. Next slide, please. And CBD is very interesting from a medical perspective and a scientific perspective what it does. We're going to talk about what CBD is, how it works. We're going to talk about some research on CBD, and unfortunately the human studies on CBD are not exactly where I'd like them to be. We're going to talk about that. I think the most important thing that you can get out of this talk is what CBD is, what it isn't, how to use CBD safely, and then what to look for in a CBD product. CBD is like the new gold rush. And so there's a lot of high quality products out there, but there's a lot of products out there that are complete garbage. And so we're going to talk about how do you spot the difference between the two. All right, next slide. So we already talked enough about me. So you can at least see my pretty face there, right? Next slide. So what is CBD? I get a lot of confusion about this because people will say, well, isn't that THC? Isn't that marijuana? And I say, no, they're related, but they're different. So if you look at CBD, it belongs to a class of molecules we call cannabinoids. And cannabinoids are found in nature. We also have our own cannabinoids that our body makes. And so the ones that are found in plants, we call phytocannabinoids, meaning from plants. And the ones that our body makes are called endogenous cannabinoids. And the endogenous just means something that's found or made within the human body. And so the CBD is extracted from the hemp plant. And so the hemp plant is a different species of the cannabis plant. That's why these are called cannabinoids. And the hemp plant actually contains very little THC. And by the legal limits, a CBD product has to have less than 0.3% THC to be legal. Now, that is not enough THC to cause any type of physiological effect. So none of the things that you'd associate with THC, like the munchies or euphoria or any of that, can happen with CBD. So if that does happen, it means that CBD product is tainted and has been altered with THC. So that's a big difference between the two. Next slide. So this is the endocannabinoid system. Remember I talked about how we had endogenous cannabinoids? They work on the ECS, endocannabinoid system. And this system has two really gates. So when we say receptors in medicine, we mean gates. And they are things that will bind to a particular molecule. Kind of like how a key fits in a lock, you turn the key and the door opens. Well, CBD is a molecule that binds to the receptor, the gate, and these are CB1 receptors and CB2 receptors. The CB1 receptors are found mostly in the brain, and the CB2 receptors are found in our nerves and our immune system predominantly. And they have slightly different functions, but CBD in itself does not actually act very directly on those two receptors. And this is why I love CBD. What CBD really does is it binds to something called FAAH, fatty acid amylide hydrolase. I know, a bunch of big words. I really wish we in medicine had named these things like better, like CBD removal molecule. Like that would be easy. Everybody could remember that, right? But that's what FAAH does. It removes the natural cannabinoids that our body makes. And those are called 2-AG and anandamide. And so what CBD's main mechanism of action is, it extracts that FAAH. It binds to that FAAH so that our natural cannabinoids to do. And how does this actually work? We like to say that what CBD actually does is it is a balancing molecule. What it does, it tends to make sure that systems are working as they should, that they're not underperforming, that they're not overperforming, that the nervous system and the transmission is doing exactly what it's supposed to do, that the immune cells are doing exactly what it's supposed to do. And that's one of the reasons why you'll hear CBD working for all different kinds of things. And then if you look on this list as well, you'll see that CBD not only has action at those cannabinoid receptors, the CB1 and the CB2, it also works at a host of different other receptors. So for instance, the TRP system is involved with modulation of pain sensation. It is very active in peripheral nerves, and this is one of the pathways that we use to modulate pain. There's also some evidence that CBD activates the same receptors for capsaicin. Now, some of you may not know capsaicin by name, but we're all familiar with it. When you eat hot peppers, capsaicin is what makes you feel the sensation of them being hot. It's what makes your mouth tingle. There are over-the-counter products and even prescription products that have capsaicin in the cream to provide pain relief. And I actually use some of these creams myself. CBD is also thought to act at one of the serotonin receptors. We typically think of serotonin in relation to mood. It is a neuromodulator or neurotransmitter that is involved in feeling calm, feeling like you have enough in the world, feeling satiated, feeling the present in the moment. That is what serotonin's main job is. And so why am I talking about this? Because it's important to know the underlying mechanism and see that CBD is acting at a whole range of things in the body to really understand why there are so many different things that people are using CBD for. Next slide. So here's another thing with CBD. There's multiple different types. There's and you may have heard of these things. Now, I prefer a full spectrum CBD. The reason I prefer a full spectrum CBD, and I take CBD every night, I've been taking it for years, is because the full spectrum has CBD, but it has other cannabinoids as well. There's CBG and CBC and different cannabinoids that have been identified. And the first lead process of the hemp extract, the hemp plant extract. So it's going to contain CBD. It's going to contain, depending on the way it's extracted, other phytocannabinoids, other plant-based cannabinoids. It's going to contain things like terpenes. Terpenes are beneficial molecules that function like antioxidants, or they function as antioxidants. Terpenes are very present in nature, like lemon peels, the thing that gives it that smell, that's a terpene. Lavender, the portion in lavender that gives it its characteristic smell is a terpene. So these terpenes have other biological properties. And in fact, some really good CBD manufacturers, what they'll do is they'll use different extraction techniques to change the terpene profile of the CBD. And therefore, you can have a terpene profile that's more anti-inflammatory, or you can have a terpene profile that's more involved with relaxation. And I think that's really cool. Usually, the CBD full spectrums are a nice amber color. So what about broad spectrum? What is broad spectrum? Broad spectrum is a little bit more processed, and in the broad spectrum, it usually contains CBD and some other phytocannabinoids, but the THC is removed. Now, remember I talked about earlier, a CBD product, legal limit of THC, 0.3% THC. So some people were like, I don't want to take any THC. I don't want to be involved with it. I'm worried about failing a drug test. I want a broad spectrum CBD. Now, the evidence that I've read on CBD and drug testing shows that there is no occurrence of a false positive with taking CBD. What that means is, in the studies that I've looked at it, where they gave people drug tests for THC and they gave them CBD, none of them tested positive for THC. So if it's a case of taking CBD and testing positive, it's more likely that your CBD was tainted. But there are some people, they work in the military or they're in police offices or other jobs where it's very stringent. They'll shy away from any type of full spectrum and take a broad spectrum. Or they'll go even further than that and they'll do a CBD isolate. So the CBD isolate is the most processed of the CBD types. And the processing really removes all of the other chemicals in it, and just so you're going to lose some of what we call the entourage effect. The entourage effect is all of these phytocannabinoids and terpenes work together to potentiate and accentuate and provide a much more broad effect than just having CBD alone. But that is an option for people who are a little bit worried about the THC to get CBD without having to worry about the other cannabinoids. Next slide, please. Okay, so now we're going to dive into the reasons that people use CBD. Now, there are some human studies, and I don't really like mouse studies because oftentimes when we look at mice studies, we give them much higher doses. They don't have, it's a not exact one-to-one translation for metabolism. And I just don't like treating people based upon mouse studies. Now, a lot of influencers and a lot of the new products you're seeing coming out, peptides and NMN and all this other stuff, are based on mouse studies. And the human evidence is not that compelling. It's the same with CBD. We have human evidence for CBD, but it's not at the level that I wish it was at. It's at the level where I feel comfortable recommending CBD, but it's not where I would like it to be. And I think there's a huge caveat here. There's a big difference between using CBD to treat a medical condition and using CBD just to help optimize health. If you're using CBD to treat a medical condition, you really need to work with a physician who knows CBD very well, because the doses for treating medical conditions like seizures are much, much higher. The doses for treating anxiety are much higher than the doses that we would use for just someone who's looking for just a little bit of optimization. So pain modulation or reduction in pain is a reason that people will use CBD. Now, if you look at the evidence, most of the evidence for pain reduction with CBD comes from topical administration for musculoskeletal pain, meaning joint aches, muscle aches, that type of thing. And so there are studies that show that CBD did provide better pain relief than placebo. And that's important because a human anything, we need to make sure that what we're doing is not just the placebo effect. Because if it's just a placebo effect, we've wasted money and we probably exposing ourselves to downside risk without any benefit, because we could have gotten benefit from just taking a sugar pill. So what I recommend using CBD for musculoskeletal pain, occasional aches and pain, is using a topical. I use a topical CBD on my back. I've had low back pain since I was 13, partially from genetic reasons, partially from injuries from working out. And I find it very effective. And there's anecdote, meaning people saying that they find it very effective for that reason. Taking oral CBD for pain modulation, it does not seem to be nearly as effective in both the studies that I've read and in listening to people talk about how they use CBD. So there is some evidence where they use higher dose CBD in clinical trials to help wean people off of prescription pain medications, specifically opioids. I think that is something that is beneficial, CBD, but again, that's something that you're going to want to use with a physician guiding your therapy. Next slide, please. Anxiety. CBD and anxiety is pretty interesting because if you look at it, using it to treat anxiety disorders, again, the high, and what the literature is showing right now is if you have mild anxiety, mild like generalized anxiety or mild anxiety syndromes, CBD can act. People who have severe anxiety, CBD can actually help them. And so these are people who have been diagnosed with anxiety disorders. Now, if you have just normal nerves or jitters or feeling anxious for some reason, I think that's a use case for normal dosing of CBD. And what I mean by normal dosing of CBD is somewhere between 20 to 40 milligrams for just these typical types of occasional aches and pain, feeling anxious, trouble sleeping. That's what I would recommend. If you look at studies with things like anxiety disorders, seizure disorders, they're using doses up 200, 400, 600 milligrams of CBD a day. which means that even high doses of CBD, the adverse effects are very minor. We'll talk about that later. But there are evidence in clinical trials showing CBD can help with anxiety. Now, again, I cannot stress this enough. If you've been diagnosed with an anxiety disorder and you want to take CBD, work with a physician to do so. We're going to talk about reasons why later. If you're someone who just occasionally has feelings of anxiousness, feelings of restlessness, jitters, that's when you can use more of the wellness dosage of CBD, the lower dose, because you're less likely to run into problems with that dose. Next slide. Sleep. So I originally started taking CBD for two reasons. One, I've had chronic insomnia since I was a teenager. And the second was I was actively trying to pursue a weightlifting goal. And that goal was to deadlift 600 pounds. And I was looking for anything that could aid in my recovery, right? How can I get better recovery at night and eat better so I can perform better in the gym? And one of the things that was recommended that I try was CBD, and I dove into the literature. And the literature on CBD and sleep is mixed. There are some studies showing that people had significant improvement in subjective measures of sleep. What do I mean by subjective measures? They say they slept better. If you look at other studies using subjective and objective, meaning hard data, sleep time, time to wake up, all of those measures, other studies show no difference. And I think that's because the studies on CBD and sleep have used CBD, they've used CBD and THC in combination. And that may be why you see some of these mixed effects. So if you're interested in trying CBD for just general problems with sleeping, occasional restless nights, that type of thing, it is something that I recommend to people that they can try. Now, the caveat there is you don't want to take CBD if you're taking other sleeping medications. You don't want to take CBD if you're drinking alcohol. That can cause excess sleepiness, excess tiredness, can cause grogginess the next day. The main thing we worried about there is physical impairment, so falls, motor vehicle accidents, that type of thing. Next slide, please. One of the things I'm starting to see pop up in weight loss products is CBD. Although I don't know of any human trials showing that CBD is effective for weight loss. There are animal studies and animal models indicating that CBD may be effective for weight loss. In animal studies, CBD was found to help decrease appetite, which is interesting because, as we famously know, what do they always talk about with THC? Munchies. And that's because THC works with CBD. THC actually directly stimulates those CB1 and CB2 receptors I talked about. Whereas if you remember, CBD has very weak action on those. So it is something that may help with appetite suppression. We don't know. These are animal studies. And then if you look at mechanistic studies, what CBD does is it can help with the browning of fat. And what do I mean by browning of fat or browning of adipose tissue? We have two types of adipose tissue. There's white and there's brown. The white tissue is mainly a storage. It's where if we eat excess calories, or if we don't burn off all the calories that we eat in a day, we will store those excess calories as fat. And that's primarily what white fat does. Brown fat, on the other hand, has a different function. Babies have a lot more brown fat because brown fat is very metabolically active. Brown fat helps burn calories to generate heat. And so that's the way that babies are able to stay warm because their temperature regulation is not at the level of an adult yet. So by increasing the amount of brown fat, what you're actually doing is you're actually increasing your metabolic rate a little bit. Now, this is not something dramatic, but I'm a firm believer in every little bit helps. So I think we need more human studies in this area before we can conclusively say this, but there is some mechanistic and there is some animal studies that support this. Next slide, please. This is the reason why a lot of people start taking CBD, and that is for immune health and that is for inflammation. So as I mentioned earlier, CBD, especially the 2 receptors, are found in the periphery. They're found on nerves. They're also found on the immune cells in our body. And what CBD is thought to do here is to decrease inflammatory mediators in some conditions. So if you look at it, there's our studies, human studies on people who had a substance abuse disorder. There's one study with cocaine, and they found that these people were able to decrease inflammatory mediators taking CBD. There are other studies, like there was one study on type 2 diabetic taking CBD who had elevated inflammatory markers, and they saw no difference. A third study looked at people with COVID, and they found that CBD administration was able to lower inflammatory markers in people with COVID. So overall, what does this mean? It means in some people, in some conditions, CBD may help to lower inflammatory markers. Now, inflammation is tricky. Not everyone with inflammation gets elevation in the same inflammatory markers. It depends on genetics. It depends on the condition. There are multiple different pathways that can lead to inflammation. And that's probably why some of these studies show improvement in certain conditions and inflammatory markers, others do not. Now, CBD can work through this through different ways. I really like it because of that NRF2 activation. This is talking about mechanistic stuff. NRF2 is our master antioxidant switch. It is the master switch to inactivate or activate detoxification pathways in the body. CBD also has antioxidant functions directly itself. And then we talked about the terpenes, those other molecules present in CBD that act as antioxidants. CBD may also help with the recycling of zinc and manganese, which are very important for inflammation and immune system function. And then there's some what we call in vitro, meaning preclinical evidence showing CBD can help prevent lipid oxidation, which is very important. Oxidation of lipids is basically the pathway that leads to atherosclerosis, which is plaque buildup in the arteries, which is the cause of heart attacks and strokes. Now, I'm not saying that CBD can be used to treat heart attacks or strokes, or CBD can be used to prevent heart disease. No, those are mechanistic, showing that this is possibly why we're seeing these events where CBD is reducing inflammation in some. What we need is outcome studies looking at that to say, before we can say that it prevents or treats or anything like that. Next slide, please. Now, there are lots of randomized trials with a medical grade, a pharmaceutical grade version of CBD for seizure disorder. There are also trials that show promise for neurodegenerative diseases, these things like Alzheimer's disease, things like Parkinson's disease. However, again, the doses are much, much higher. And I would not recommend that anyone start taking these for any of those things unless they're seeing a physician. Please.
So this is something I'm starting to see pop up on different products, saying using CBD to help regulate blood sugars. And there's is some what we call preclinical evidence, meaning mechanistic evidence that supports that CBD may help with blood sugar regulation. And this could either be due to the CBD's antioxidant or anti-inflammatory effects, because we know that inflammation is a root cause of insulin resistance. Insulin resistance is the mechanism behind which diabetes develops. Insulin is the hormone that helps regulate blood sugar. And so when we overconsume calories, the body stops listening to that insulin signal and our blood sugar rises. And when it gets high enough, that's diabetes. Now, the main problem with elevated blood sugar is it starts to attach to things it's not supposed to, and that leads to inflammation. So it may be a direct effect of sensitizing the body to insulin. It may be because of the antioxidant or anti-inflammatory effects. Now, before anybody can say, hey, you have high blood sugars, you should try taking CBD, we need more evidence. But there is some mechanistic data to support that one day we might have some better evidence to support using CBD for blood sugar regulation. Next slide. So here are the cautions with CBD. Overall, even with high doses of CBD, I've seen studies using 1,500 milligrams of CBD per day in some cases. The adverse effects are minimal. Diarrhea, fatigue, nausea, those are really it as far as the adverse effects of CBD. Now, if you're using it really high doses in some people, or even moderate doses, some people may feel more sleepy or more tired or groggy when they first started, depending on how they're taking it. And again, like we mentioned, that some people who have anxiety disorders and the anxiety disorders are moderate, then they may experience a worsening in their anxiety. The main issue with taking CBD is it interacts with a bunch of different medications. And the reason for this is CBD, when it's metabolized, goes through the major organ systems in the liver that help our bodies digest drugs and break down medications and supplements. And it appears that in low doses, or when CBD is taken initially, that it prevents these enzymes in the liver from breaking down medications or certain supplements. And the ones that are most implicated are medications used for seizures, are medications used for anxiety and depression, and even some of the medications we use for the immune system, like tacrolimus and cyclosporin. What can happen with chronic CBD use or with higher dose CBD use is you can actually induce those breakdown molecules, meaning you actually start breaking down faster medications and supplements. And in that case, sometimes when people are taking CBD, you need to increase the dose of certain medications. Whereas when people start initially taking CBD, you may need to decrease the dose of certain medications. This is why if you are on medications and you want to take CBD, it is imperative that you discuss this with a physician, because there are so many different medications that it can interact with, or a pharmacist who is well-versed in CBD. There are several pharmacists out there now who are providing this type of coaching for people, and they will work with your physician to adjust if CBD is something that you really want to do. And I cannot stress that enough. Just because things are natural doesn't necessarily mean they're safe. Things like, botulinum toxin are natural, not safe. Things like nightshade, deadly nightshade, foxglove, that's natural. You wouldn't want to ingest that. Certain species of mushrooms will kill you, right? So we need to get out of that notion that just because things are natural, it means that they're completely and utterly safe. Next slide, please. Now, here's how you evaluate what to look for in a good CBD. One of the things that's happened recently, and the FDA just came down on this, is that companies were making claims for CBD to treat medical conditions. So if you see that on a website, this helps with your diabetes, or this helps with your anxiety disorder, or it'll help fix your depression, run. That's how you know that that company is doing things that they're not supposed to. Watch what they say on the website. How do they market the CBD? If they market it around terms related to balance, terms related to optimal health, terms related to wellness, that's most likely a better company, because that's how recreational CBD should be used. And what I mean by recreational is for people who are looking for the things that I mentioned earlier, not using it to try to treat a disease, but using it just to try to provide some balance to certain systems. You want to look for a COA, certificate of analysis. And what you want to look for, it should be easily found on their website. If it's buried in some backlinks and you have to go searching for it, that's not a CBD company you want to use. You also want to look and see, are those certificate of analysis updated? Because sometimes companies will post them and you see that COA is 3 years old and it doesn't correlate with the batch that you have in front of you. Good CBD companies, you'll be able to go see the certificate of analysis. You'll be able to see your batch because there will be a number on the product, and you can see exactly what your CBD has in it. If there's any THC, what other phytocannabinoids it has in it. Some of the companies will post terpene profiles. The really good companies will also post profiles related to toxins and pesticides and things like that, mold contamination, just so you have a full view of what you're getting. Again, we talked about this earlier. If you want to do full spectrum versus broad versus isolate, make sure that if you want to do isolate, that you're getting an isolate product. You can look for the amount of THC on that certificate of analysis, right? If you're someone who does not want any THC in your CBD, make sure you check that certificate of analysis to make sure it is THC free. I prefer US grown. Most of the CBD here is grown in Kentucky, so you'll see that a lot of times. If a company is CGMP or FDA inspected, third-party FDA inspected, or third-party inspected, if they have like NSF, those are all organizations that go and make sure that the product has what it says it has in it. They test the product. It's a very high standard of making supplements. It's a misnomer that the supplement industry is unregulated. It is regulated, but the manufacturers are supposed to follow the guidelines. Now, the FDA really only intervenes after they get reports of something bad has happened to people, or reports from consumer watch groups that something's going on. Consumer Lab Reports is an excellent resource where you can go and look at different supplements and other products, and they do testing and they report what they find on that testing. Now, bioavailability is how much of that CBD is actually being absorbed. So if you look at it, there's a couple different ways that you can do this. The nano or the liposomal CBD, these are usually more expensive, but they're formulated to increase the amount of CBD that reaches the bloodstream. CBD is not water soluble, so if you're buying CBD coffees or CBD teas that are infused with CBD, you're wasting your money. I've looked at studies on those. They don't contain any CBD. That the heat destroys the CBD. The other versions that you'll see is just regular oil that you're asked to place under your tongue. And why do you place that underneath your tongue? The area underneath your tongue actually is in very close proximity to blood vessels, and it dramatically increases the absorption of the CBD when you place it under your tongue. So if you want it to be a fast-acting CBD, place it under your tongue. What I do when I go to sleep is because I don't want it to be fast acting, is I actually swallow it. And that makes it more of a slow release product. And that's what I want when I'm trying to sleep. So, I don't wake up in 3 or 4 hours, that I get a good 7.5 hours when I sleep. Next slide, please. This is just references that I use to put this presentation together. I always include references so you know that I'm getting that there's data. And this is my contact info. I post a lot on Instagram and LinkedIn. And then I have a podcast where I talk about CBD. It's old now, but it still covers the basic principles and a lot of what we covered today, if you want to go and look through that. And we got about 15 minutes left for questions.
Okay, Dr. Harris, thank you very much for that. I guess we'll get started. Can CBDs help improve symptoms?
I cannot make any claims that CBD can improve symptoms whatsoever because it is a supplement. So what we talked about in the presentation today were some reasons why people take CBD, and then what the data shows regarding why people take CBD.
Okay, thank you. Does CBD have any side effects for those with sarcoidosis, specifically lungs, eyes, and joints?
The main thing that I would be worried about with someone who has sarcoidosis taking CBD is the medications that they're on, especially if they are on immunosuppressant medications. So like I mentioned, the cyclosporine, the tacrolimus, mycophenolate, those types of things. There could be some concern with either increasing or decreasing the concentration of those medications like we talked about. As far as from a disease process, there's no data, and there's probably no data that I'm aware of looking at CBD and sarcoidosis from a disease pathology process. CBD is used by people with autoimmune disorders because of some of the studies showing that it can reduce inflammatory markers. Like anything else, I tell people start low and go slow if they want to try CBD, with a few milligrams, 5 milligrams a day, and go from there. Like I said, for wellness purposes, most people will do somewhere between 20 and 40 milligrams of CBD a day in divided doses. Maybe that's 1 or 2 doses per day. But if you are interested in using it, definitely get with either a physician or a pharmacist who is well-versed in CBD, who can kind of guide you through some of these pitfalls. And the main one, like I said, is medication interactions. The studies I've read have shown no severe adverse consequences. They were very minor, like nausea, diarrhea, and fatigue.
Great, thank you very much, Dr. Harris. Some of the live questions. What if someone has inflammation from sarcoidosis, but also has a seizure disorder controlled by the medication?
Yeah, that could be something that if it's controlled by the medication, you're going to want to be very careful starting CBD, since CBD can interact with some of the seizure medications. This would be something that you would work with your neurologist for if it's something that you want to try to help reduce inflammation and joint aches and things like that. If it's for, joint aches and pains and things like that, I would recommend the topicals, because the absorption is not as high as it would be for orals. I can't say there's no absorption because it depends on who formulated it and how it's formulated, right? But again, before using any type of CBD product, you're going to want to talk to your neurologist because there may be some things that they have to do with your medication.
Great, thank you. Another question. I was on CBD to manage the pain caused by inflammation, plus to help with my anxiety. Sadly, I had to stop the CBD because I started a treatment with my naturopathic doctor for my anxiety. But I can truly say the CBD worked for me. Do you have any particular brand that you would recommend?
The brand I use is from a company called CBD Health Collection. And this brings up a really good point. This is something that I advocate with people first. If you try something and it works for you, insist to your provider that this is what I want, this worked for me. How do we craft a plan around this? Because if you don't tell them that, they're gonna do what they think is best. What we do in precision medicine is we think about things differently. An N of one, meaning your experience with stuff, is what matters the most. I can look at the data and I can pick out something and say, based upon the data and your symptoms and your lab work, this is what I want you to try. And you try it. And then you say, you know what? I don't feel as good as when I was on this. That matters, right? So if it was working for you, you felt like it was working for you, go back to your natural path, talk about it, find a path that you can incorporate what was working for you into their plan.
Thank you. Dr. Harris, can CBD help with small fiber neuropathy and joint pain? I have both in my hands.
Yeah, small fiber neuropathy is quite a beast. I know because I have some small fiber neuropathy. My mom has an autoimmune version of small fiber neuropathy. I don't have any data on this, right? Me personally and my mom, their anecdotes, our stories, CBD has helped with our neuropathy, right? So it is something that if I say based upon my personal experience, based upon what I know about CBD's mechanism of action, that it may be helpful. I don't have any hard clinical studies in humans that I know of that show that.
Great. There's a question. I think we need some clarification, but I guess you'll try your best. Taking the medication makes everything worse, and especially mobility. What should I do to alleviate this? I'm not sure if they mean the CBD medication or other medication. I would imagine CBD.
Yeah, it could be CBD or it could be some of their immunosuppressant medications, just what the regimen that they're on. This is what I talked about earlier. If you were on a regimen that was working better for you, or if your regimen's not working, that's something that you have to discuss with your physician to find a regimen that does work for you. In addition to working with a mobility expert who knows autoimmune disease to help you slowly get into mobility work and mobility exercises. And I know it's tough for people with autoimmune disease to do that. There's a company I know that does that, and but I can't remember the name of it. If I remember, I'll let Abigail know to reach out to send that out. But I think that's important.
Dr. Harris, can you comment on CBD versus THC?
Yeah, I think this is something we covered pretty well earlier. So CBD and THC have, in some areas they act the same, in some areas they act different. CBD, again, may suppress appetite. THC increases appetite. THC can cause psychosis, right? Whereas CBD is often given with THC to prevent THC from causing psychosis. So again, they're both in the family called cannabinoids, but they work a little bit differently in the body. So there are some conditions and some reasons why you may want a THC only. There are some where you may want a THC and CBD mix, and there are some where you'd want a CBD only. But that really just depends on why you're taking it, what you're taking it for, and how your body responds to things. But I think you're going to see a lot more, especially now that there are several states where medicinal THC is legal, where you're going to see, either THC, CBD, THC alone, or CBD alone, or some combination of either one. But I can't tell you which is better for a certain indication, because it does vary on that indication and it varies by individual.
Great. Can CBD help people with pulmonary sarcoidosis?
So the answer there is I don't know. And the reason I say I don't know is because it has not been studied in any type of sarcoidosis that I'm aware of. Like I said, there are reasons mechanistically why it would make sense. What we know about people with sarcoidosis is that they tend to have a lower total antioxidant capacity. What that means is that people with sarcoidosis generate more oxidative stress or more oxidative damage than the body's able to repair. So in theory, and why I say in theory, because I'm not aware of any human studies that have looked at this, supporting with antioxidants like CBD could and may help with some of the underlying pathology with sarcoidosis. But again, I don't know for sure. And that's something that you would want to talk to your pulmonary specialist about.
Thank you. This is a live question. The median age of diagnosing sarcoidosis is between the age of 20 and 40 years. So by age 55, could you assume you won't be impacted by sarcoidosis, even if genetically found in a family tree?
The likelihood would be very low, but there's still a chance. I would say that the likelihood would be extremely low. But you never know, especially since we don't know the why people develop sarcoidosis, right? We think that most of these autoimmune syndromes, you have a genetic predisposition or an environmental predisposition, and a trigger event happens. That could be a viral infection, it could be trauma, it could be stress, something. And that triggers the development of the autoimmune disease. So given that, you've circled the earth 55 times, then you've experienced a lot in those 55 years. The likelihood of it happening to me would be low, but it wouldn't be zero.
Thank you. What are your thoughts regarding CBDs and improving gut health?
That's a good question. I don't know of any data on CBD and looking at does it improve the microbiome, and that's a really hard question to answer because we don't really know too much about the microbiome yet. We're still in its infancy. Anybody who says they're a microbiome expert isn't. Like, no one is. What we know about a microbiome that we can say conclusively is that more diversity appears to be better, and that the diversity is typically caused by what we eat. So things like fiber and certain antioxidants, polyphenols from fruits seem to really feed the gut diversity and help with the microbiome making certain things. Now, mechanistically, I can think of CBD could be beneficial for processes that are happening in the gut, especially with those who have gut issues related to nerves and stress. But I don't know of any direct studies showing any tangible outcomes with CBD and gut health.
Okay, great. There's a question about topical products. I think you touched on this, but they say, I use a CBD THC product that seems to help for neuropathic and joint pain. Is it just a placebo effect?
I don't think so, because there are human studies. Again, the level of evidence is not where I'd want it to be. I'd want to continue to see more studies showing positive results, right? Before I feel great about it. I feel good about it, but I don't feel great about it. I don't think it's just placebo effect. I think because we have trials showing improvement compared to placebo, then it's not placebo. That one study I pulled up showed people had a 40% reduction in pain scores with CBD, whereas only had a 20% reduction with placebo. So that in itself is showing that we're getting a greater effect than placebo effect.
Thank you. We have a last question. Can you take CBD with tramadol or other pain medicines?
That's very dicey because, again, the things you worry about with pain medicines are sedation, and depending on the pain medicine, they might go through the pathway that CBD goes through. So you could get an increase in that pain medicine, which some providers do stuff like that to prevent tolerance, but you would need to work with a pain medicine doc who is well-versed in CBD. Some of them are using CBD to help get people off pain medications like tramadol. So, and yes, you can use them together, but you need to work with an expert who knows how to titrate up and down the CBD and the pain medicine.
Well, Dr. Harris, thank you very much. I think we've covered all of the questions. We may have one or two, but I think they were answered in the past. So thank you very much for a great presentation. I know you were very busy schedule tonight. So thank you very much for doing this. And thank you everyone who's attended, participated. We do provide educational webinars on a monthly basis. So please check our website for upcoming talks. Thank you again to everyone. Have a great night and stay safe.
Thank you, everyone.